Listen, man, I'm happy to be here. I'm a huge fan of yours. I see your stuff on Instagram, and I saw you talk, and it was great. And the first thing I said to besides everything you mentioned, I'm on the board of directors at the SMHP, in the Society of Metabolic Health Practitioners. So if you're a doctor or a nurse practitioner, or PA, or a health coach looking to get trained, this is the not for profit, the largest not for profit that specifically has a mission to educate healthcare providers on metabolic health. Yeah, I mean, look, I'll tell you, look, besides, I was 350 pounds 10 years ago. I was a chief resident in Yale, and I did probably what you did, which is I went to the medical literature. I'm like, what's going to work for metabolic health and weight? What's going to work? And you look into the data, and all of a sudden, it's like, wait a second, it's not exactly what we were told. It's not about calorie counting. Doesn't work so well. Low-fat diets don't work so well. At the time, it was very clear low-carb diets seem to be better. And so, I had to go and learn about nutrition and lifestyle and sleep and exercise. And what I found was a lot of what we thought was true was just, I don't want to say propaganda. I don't want to say anchored in heuristics, like that just doctors don't change. They kind of learn something and they're just, they don't want to like adapt to new information. But when I saw this information, I read 3,000 papers. I read 300 diet books. I was a desperate 350-pound guy. And so I lost 150 pounds, kept it off now, and I desperately wanted to create a practice that I wanted, that I would have wanted as a patient. So, and I wish I had a network of doctors to pull from, right? And so the way the SMHP and my practice got started was, when I started the practice, I was like, well, what would I want as a patient? I'd want to be completely connected. I wouldn't want to have to come in. I wouldn't want to waste time. I'd want to be able to text. I'd want an app for asynchronous education. I'd want real-time biofeedback, sleep studies when I need it, CGMs when I need it. I'd want all these things easy and accessible. I'd want a team that's been through it and cares, right? So we built that, and then, I went back to Doug Reynolds from Low Carb USA. I said, we need a physicians organization. There's no physicians organization. And this was like 5 years ago or 6 years ago. And so we made it with Eric Westman, Rob Sivis, Mark Cucuzella, Dr. Laura Buchanan, who works with me, Miriam Kalamian, and so many others. Now we have 500 people, 500 healthcare practitioners. Over 100 are accredited. We've created an accreditation. And this is all not for profit. So, this is not some, our goal is to be the doctors I wish I had. I had to cold call Mark Cucuzella. Imagine being a 350-pound doc, okay, and you see this guy changing West Virginia University to like low sugar, and you're like, this guy gets it, but I need to talk to him. And I cold called Mark Cucuzella. I remember this was 2016. And I'm like, Mark, how did you do it? And he's like, he was like a mentor to me. So, we need that avenue for people like you and me to be able to connect, and then also to mentor the next round of students and residents and PAs and NPs and nurses. So that's how the SMHP started, and it's just grown since. We have 2 conferences a year, and it's fantastic. Look, I'll tell you, I always wanted it, my story is checkered. I'm not going to go into it, but I can go back to being 13 years old, and I remember that's when I wanted to be a doctor, I remember. But I've always wanted it. And I think the problem is when you're beating your head into the wall again and again, and the doctors are telling you, no, you got to keep beating your head into the wall. Calories, low fat, if it fits your macros, whatever it is, all these concepts that are not exactly wrong. I'm not saying they're wrong. They're just not exactly right. And when you start to connect the dots that, hey, look, satiety is key, hunger is key, cravings are key, how not to feel deprived, how to manage social situations when you're dieting and recuperating from them if you go off plan, how to, manage your emotions, cope, These are all the things they don't exactly tell you, right? They're just like, go count your calories. And that's not it. So I always wanted it. I never wanted to be 350 pounds. I've yet to meet somebody who wanted to have diabetes or have hypertension or obesity, But the problem is you have to figure it out. And we don't have a lot of good shepherds, right? We have a lot of wolves. The profit, we have a for-profit, basically, a medical system that is not accountable to outcomes, right? And even if it's not for profit, they're not accountable. In Canada, I know it's a public system, but that doctor, right? He's going to say, well, if you can't do it, that's on you. But we need to think as providers, what do we need to help our patients do it? We've heard in the last 20 years that obesity management is the diet you can adhere to. At what point will doctors say, it's my job to get the patient to adhere to it? It's my job to inspire them. It's my job to give them information. It's my job. So take responsibility and ownership. That's what you said about healthcare, right? So you're talking about the individual. My mission now is to make it the systems, right? To make the doctors responsible, right? It's your job, right? It's your job. Those are your patients. This is your mission. You have the knowledge, and if your patients, imagine you have a class, and 95% of the class is failing. That's what we have, right? That's metabolic health. 95% of our population is metabolically unwell. That's not an individual problem, right? That's not an individual problem. That's a physician, medical health problem. The teachers are to blame. Oh, yeah. The guy with the watch. He's got the watch. Yeah. Doesn't he do the watch? He takes a picture of his watch. It's 4 a.m. Bingo. Bingo. Well, so this is it. So step into my mindset. This is me in a silo 5 years ago. Take it a step further. People don't want to come to your office. You were in the ICU. You know the people that were dying. They were overweight, had metabolic syndrome, high triglycerides, right? You see it all the time, right? Those people are, and I was that person. We have intense shame and guilt. We have intense self-blame. We blame ourselves. We don't have enough willpower, right? We don't want to step in front of your office. We don't want to come in on your scale. So I thought to myself, we need remote equipment. This is 5 years ago, before COVID. We had remote blood pressure cuffs, biometric scales in every patient's house. We were watching, we are the biggest prescriber of CGMs in the East Coast. I am in the top 1% of CGM prescribers. Okay? Why? Because we should make it easy. They don't want to come in. Why come in? Why waste time coming in? We can watch your blood pressure, weight, blood sugar completely remotely in real time. I can reach out to you when I see something off. You can reach out to me when you need help. Right now, think about other things in our lives. I thought to myself, I have to be able to beat AAA. AAA, the company you call when you get a flat tire. You can call them or text them and you can get a hold of somebody in 5 minutes. Medicine's got to be that easy. You got to be able to text. So we have real-time sort of text messaging. People don't want to wait to see you. They need an education platform on their own time. So every doctor should have an education platform. We have a whole platform, a whole curriculum, cited videos. We have podcasts you can go to. We have meetings. People should have a way to come together to discuss their struggles or what they've done. We have a meeting every day. Tuesdays, Wednesdays, Thursdays, Fridays. There's something somebody can come to. We do live podcast recordings. We have a big group hundreds of people all throughout the United States getting together Tuesday, discussing a topic. We have small mini groups on Wednesdays. So the point is to form those social bonds of people just like you, who've walked the walk, the people who are intensely serious, right, and are on the journey. So the idea here has been, how do we create the ideal model? Because the ideal model in medicine, right, I know you talk a lot about medical models and what we need to do. You know, what we want to do is we're right here. So the biggest disaster in medicine is going too long and far away from a serious medical issue. And the same is true for lifestyle medicine. Like, you have a heart attack and you wait. It's the worst thing. You have a stroke and you wait. Like, I got this, I can do this, it's going to go away. Right? That's the worst thing, possible outcome of medicine. Medicine wants to get you right away. They want you to know the signs of a stroke and a heart attack, and they want you to know to reach out for help in that minute, because the closer we get to that minute, the more we're going to be able to help you. And the same is true for lifestyle. You know, what happens? You eat off plan, and you can go months before you get back on track. And what we want to do as a clinic with lifestyle and medicine, both of them, is get to that minute. We saw it on the CGM. How can we help you out? We know you're probably stressed out. Is there something we can do? Your heart rate's gone up. Your blood pressure's gone up. Can we help you? Right? Can we help you? Because we want to get to that minute where somebody ate the ice cream and they're about to regret it, and we're there for them. Right? We're there for them. We call it moment zero. We want to get to moment zero. Right? So we don't want somebody to wait 12 hours to get to us with a stroke. We want to wait like 12 seconds to get to us with a stroke. Same thing with lifestyle. We want to get close to the point of which I'll tell you sucked, and I'll tell you why. Direct to consumer is a challenge because the costs are so high. Right? The costs are so high, and we pass that on. We don't take insurance. So, like, if I accept an insurance contract, they're going to pay me $17, and so I'm going to see you in 7 minutes. Right? That's the problem. And I'm going to spend my time thinking about needless things to do to you, like EKGs and allergy tests and spirometries, just so I can code more and bill more. That's how insurance makes me think. So the first thing I did was, I'm not taking insurance. They're a corrupting force. They take me away from the patient. They make me think in a bad way. You know, I was like, they have no place in my practice. So we don't take any insurance money. It's direct to consumer, right? And so the consumer doesn't see value in me. They walk away. I constantly have to prove my value. I constantly have to get better. I constantly have to be better. And that's the way I want to be. That's the way so it's a challenge. You know, we charge $200 a month for metabolic care. I know you're in Canada. That's like 300 Canadian or 250 Canadian. It's not cheap. But it's not cheap. So my goal was to get, and my real wish is to get the price under the cost of a cable bill. Right? So that'll be my goal. If we can get our costs under a cable bill. What we found is what we found is it was very much sort of affluent people who were very desperate or had disposable incomes that were coming to us. It was very limited, right? But the people who really want us are the employers, and so we just we had an interview on CBS about our employee wellness program, and we've published on our employee wellness program, and it's a win-win-win. The employers are bearing the burden of healthcare costs. We save them money within 12 months. We are cost neutral for them within 12 months because of the rapid, weight loss, change in diabetes and hypertension. We're able to discontinue medications that are no longer needed. Right. So, not only that, I thought they cared really about money, about prescription money, but what they're really after is worker and worker happiness, worker productivity and worker happiness. So, which is, you'd imagine if somebody's sort of depressed and sick and not working, to their optimal, that costs companies a lot more. And so we have found our biggest successes have been with employers, and they are paying for our program completely. It's free to their employees, and we make it on a volunteer basis. It's not like forced. We don't want to force it on everybody. We want the people who we're going to have an impact on because they're ready to make a change. So it's not like an employee wellness program where like you have to go get your lipids checked and you freaking hate it to get $500 off on your whatever, on your premiums. It's we have a program where you can, excuse my language, unfuck your health, right? You can unfuck your health and your employer will pay for it. And they get personal trainers, health coaches, doctors, they're all part of the program. Oh, I know what that's like, man. You got it's got to be a kid. No, no, it's all right. It's got to be a kid. Was it a kid? Yeah. You got to go do it? No, it's okay, man. I know what it's like, man. I know what it's like. I've been podcasting for 4 years, so I know what it's like. And we to fulfill our mission. I mean, every single person in our practice, Amy, I guess my program director, she lost 220 pounds, kept it off 6 years. Brian Wiley lost 100 pounds, kept it off 15 years. Started with the Atkins book. Dr. Laura Buchanan, she was pre-diabetic. She was skinny, but she was pre-diabetic, right? And she's 20 something, right? So, and she's a board certified family physician and board certified obesity medicine doctor, brilliant person. She never showed it. I showed it on my waist and my body, but she had pre-diabetes, right? And all of us have been impacted by metabolic health, right? So our mission here is, yeah, we want to earn money and have an income and all that stuff, but ultimately, we're here to do good work. And so we ring a bell when somebody reverses diabetes. That's the bell we ring. Oh, there's a reason. You want to know what the reason is? You and me. We've never organized, right? The vegans have organized, like they have the ACLM, right? The AFP can't be trusted. I said this at Denver. I don't know if you caught it. The AFP can't be trusted. ACSM can't be trusted. They took money from Coca-Cola. Can't be trusted. The ACLM is not. They want health, but they want it within the confines of plant-based, right? And so there's been no place for you and me, doctors, to become a peer network and a group, right? I think that's my personal, you know. Um, why? I mean, I have my reasons. I'm just curious. Why do you? I don't want to get too conspiratorial on such a friendly podcast, but why do you think that is? Cash rules everything around me. Yeah, yeah. You see benefit without any weight loss in diabetes. So if you have diabetes, high triglycerides, metabolic syndrome, you do not need to lose weight. You can essentially, I've seen A1C of 12 go to an A1C of 5.5 in 3 to 6 months. So immediate. We stop insulin day one in type 2 diabetics that quickly. Okay, that quickly. So we have seen, I can't even count how many people have lost 100 pounds or more in our practice. That employee wellness program I've talked to you about, we have more than 5 people who've lost 100 pounds without medications, without surgery. And what does that look like? I think the hardest part is not the ideal, which is the ideal is always, meat, fish, chicken, eggs, Greek yogurt, green leafy vegetables, berries. That's the ideal for most people, right? And if you ask them, what's your ideal diet? They say protein and vegetable, right? I think where people need our help sometimes is like, what do you do if you're craving pizza? What do you do if you're craving chocolate? What do you do if you're craving, what are you going to eat? You can't stop drinking soda. What are you going to do? Right? And I think that's, part of it is like, how do you go from this addictive food environment with all this sort of crazy, awesome foods to your ideal of meat, fish, chicken, eggs, Greek yogurt, green leafy vegetables, and berries? And that part's hard. What do you do when you go to family gatherings? What do you do when it's late at night and the kids are asleep, you're watching Netflix? What do you do when we're watching the NBA playoffs? Right? Which is what I'm doing right now. What do you do? And so the part is not the ideal, because everybody has a pretty good vision of an ideal. Everybody's the same. I've asked people, what's your idea of a healthy diet? Everybody says protein and vegetable, right? What happens is, what do you do when you can't do your ideal because you're hungry or you have cravings or you feel deprived? What do you do when you have social situations and you don't know how to handle? What do you do when you need to recover because you went off plan and you need to figure out how to get back on track quick? And what do you do when you have emotions and stresses and you don't know how to cope otherwise? So the food is easy. I mean, steaks, eggs, salads, fish, asparagus, mixed vegetables, some berries here and there if you need a dessert, Greek yogurt. That's what it looks like. Then, how dirty do I get? Meaning like, Lily's chocolate, Quest pizza, Rosette's cookies, stuff like that. Which are low carb replacement items, Quest chips. I try to just keep those to as minimum as possible. But they do make an appearance in my diet. I'd say probably like 2 times a month. I need some sort of junky replacement, because otherwise I would have eaten, Doritos. It's a no-brainer for me, somebody who exercises, to pick Quest chips over Doritos, and I got no stock in Quest, right? I got no stock in them. It's an easy, what's the ideal over that? I mean, eat some meat and vegetables, right? So that's what it looks like. How quickly? Right away. Right away. Yeah, we get them. We show them how to make pizza. We show them where to buy pizza from. Blazed pizza, lit pizza. It's got low carb crusts. There's a sausage crust you can get from Chicago, actually shipped. We could show you how to make pizza. Rosette's got full disclosure. That's my wife's company. That's got an almond flour crust. It's basically flathead dough in a bag. So we show people if their goal is to meet a craving, there's ways to do it, right? If your desire is to think that you can eat that every day and lose weight, it's not going to happen, right? If you need pizza once a month in between or occasionally when everybody else is eating pizza, right? We got you covered. If you think you can eat this stuff every day and lose weight, we need to help you recreate a vision of your health. So, yeah, go ahead. we try to stay away from counting as much as possible. So we make it pretty easy. I mean, this is my advice. If it's meat, fish, chicken, eggs, Greek yogurt, green leafy vegetables, or berries, don't count it. Don't count them. And now, when I say berries, strawberries, blackberries, raspberries, right? Not blueberry. Screw rubies. Nobody likes blueberries. Okay. Yeah, because they're so much higher in sugar. Yeah, but no, there's nothing wrong with blueberries. But I'm just teasing. But but yeah, we try not to get. We tell them to count if it's any other food, right? If it's another food, count it, right? And that's basically nuts, low carb snacks, other fruit. Start counting. Trying, man. Trying. Yeah, yeah, we definitely need soldiers, man. We definitely we need commanders too. That's the thing. We need people who are teaching residents, and students. We need physician leaders. We just need a lot more than Crazy Tro and his podcast. So it's good to meet. It was good to meet you, man. I've been following you on Instagram for a bit, so now I feel like I'm a social media stalker. But, yeah. Yeah, let's throw it down. So you can get me on any social media at Dr. Tro, spelled out DoctorTro. You can get the app, Dr. Tro app. You go to any app store, Dr. Tro app. We have 10,000 people on the app. Come join us, free. You can just sign up, start talking, get things for free. If you want to throw us a bone and get some of our weight loss curriculum, you can, but you don't need to. You can get me on the podcast, Low Carb MD Podcast, and go to the website, drtro.com. You could text a live human right through our website. So we are text enabled. And get this, another thing I wanted when I was back 350 pounds, I wanted to create a hotline that people could call and get help right now. So I made a hotline on the app, a Get Help Now part of the app, where if you're struggling, binge eating something, you need help right now, there's 50 people who've lost weight off and maintained it off on our app. You hit Get Help Now, you type in your question, 50 live humans will respond to you who have maintained weight off to get you help. No, man. No. I don't know, but I don't know. I don't know about that, but I'll take it. Game changer. Oh, we were just talking about basketball. Ball changer. I don't know. I was a diaper changer at one point. Thank you, man. You're gonna come on too, right? Did I send you out the link? Okay. Did I give you the link already or not yet? I'll send you out the link. Yeah. Hold on, let me give it to you now. Otherwise, I'm gonna forget.